Hi, everyone, and welcome to episode 123 of the Veterinary Behaviour Chat podcast. And today we have yet another one of our super popular 15-minute speed coaching episodes. And today I'm joined by Dr. Laura Stoeker, and she has a super interesting topic to chat about. I'm going to let Laura introduce herself a little bit more, her background, her career, where she's working now. And then once we've kind of gone through the introductions, I'll explain the rules of the 15-minute speed coaching, and then we'll get right into it. So welcome, Dr. Laura. How lovely to have you here.
Thank you. So I am a small animal veterinarian. I work primarily with dogs and cats. I've been a veterinarian for 11 years. And I work in the United States in Iowa for a corporate practice.
Mm-hmm. Okay. And do you see a lot of behavior cases, or do you see kind of general practice cases with behavior?
Yes, that's how I would say it. I see general practice with behavior thrown in.
Okay. All right. And what, a lot of your cases are behavioral, or is it just that your general practice cases are showing more behavior presentations?
I would say that a lot of the general practice cases are showing behavioral presentations. They'll come in for a wellness and then mention something like, oh, well, no, my dog's also having anxiety, or my dog has noise phobia, or this. It's kind of like they come in for one thing and then bring up behavior issues while they're there.
Yeah, so interesting, because I'm hearing that more and more. I don't know whether pet owners are getting better at understanding that behavior is something that they can talk to their vet about, or whether we're just generally seeing more behavior presentations, or I'm not sure what it is. But I'm hearing a lot of GP vets saying exactly what you're saying, that they come in for something, and then there is very often a behavioral challenge kind of thrown at us at the end of the consult.
Yeah.
Okay, so I know you have a very specific topic that you'd like to chat about today, and I will let you ask the question as soon as I hit the buzzer, but let me explain the rules of the 15-minute speed coaching. So it's pretty kind of off the cuff. We chat away about a certain topic. It's not pre-prepared, so I just kind of answer the questions that you have pretty much unprepared, and we just have a conversation about what it is that you'd like to talk about. But the buzzer goes at 15 minutes, and that is it. Wherever we end, we end. Wherever we get to, we get to. We usually end up at a resolution of some sort, but we have had a couple of episodes where we've ended the episode right on a cliffhanger. So that might happen, but we'll see where we get to. So wait, let me get my alarm clock ready. Okay, I'm ready. So I will press the button, and then Dr. Laura, go ahead and ask your question.
All right, so I would like to talk about hyperactivity, hypersensitivity syndrome in dogs. The reason I want to talk about that is because I have a dog that has it, and I had to go to a behaviorist to get it diagnosed because I had no idea that it was even a thing. Yeah. And I have a fairly interest in behavior. I took extra classes in school and stuff like that. I'd never heard of it before. So I wanted to ask you what you're looking at in a clinical history, what key words or key parts of a history makes you think that, hey, this may be a dog that has this going on.
Yeah. Okay. Great question. And I agree with you. This is something that we're seeing perhaps more and more recently, although there is quite an old paper in the literature, I think from the 1990s, that describes hyperkinesis in dogs, which I think is kind of the same thing. So I think potentially it has been recognized for a long time, but maybe we're just not seeing it, or we haven't seen it traditionally as frequently, and it's coming up more frequently now. Maybe also we're not meeting behavioral needs as well as we should. Maybe, breeding has kind of also created more dogs that have a tendency towards this behavior. And I also want to just say that I think there are a lot of related terms. So hyperarousal, perhaps impulsivity, perhaps frustration, are all these sort of related terminologies. But I think when we're truly talking about hyperactivity and hypersensitivity and hyperkinesis, the number one clinical sign that we're looking at is increased motor activity. Increased motor activity to a point where the dog finds it really difficult to settle, and might be paired with hyperarousal, so sympathetic arousal, even though I do think we need to separate the two, but sometimes we can still have sympathetic arousal even when the dogs are trying to rest. So increased heart rate, increased respiratory rate, this kind of inability to settle and actually rest. I think a couple of other things that we see sometimes are inattention, so dogs not being attentive to cues or signals, perhaps from the owners or the caregivers, a lack of being able to focus on something. And interestingly, a lot of work around hyperactivity has been done in military working dogs.
Oh.
So that kind of inability to focus, that interruption of their work or the task, that can sometimes be something that's in the history, you know, that he used to be able to focus, concentrate, work. Now, all of a sudden, the dog can't. And then in that same context, we would sometimes also see abnormal repetitive motor behaviors. So maybe spinning. Again, in the working dogs, they often talk about these tail tip injuries, right, where the dogs are either spinning around and being self-injurious or perhaps injuring themselves in that sort of kennel environment that they're in. But those would be, I think, some of the main clinical signs that would alert me. In the French classification, and this is where the European system and the American system sometimes differ a little bit. In the French classification, there are two other sort of cardinal signs, which are reduced sleep. And the second one is poor satiety. So dogs that are constantly hungry and constantly looking for food, and then even like eating non-food items as a replacement. And in the French terminology, it's that what you mentioned earlier, Laura, that HSHA, hypersensitivity, hyperactivity syndrome.
Okay, so people are when they're coming into you, what are they saying? Are they are they saying, because when I came into the behaviorist, I was coming in because I have a Boston Terrier, so not a traditional breed for this, but I was coming in because he was acting like a herding dog. He kept biting the ears and legs on my other dog at home, and we had no peace. And right. I think it was an impulse control thing. So are people coming in primarily for things like that, like impulse control, or are they coming in and saying, hey, my dog can't sleep, my dog's crazy, my dog's this or that?
I think it depends from case to case, but I think all of the above could be the case. So I think that my dog can't rest, he can't settle, he can't sleep, he's constantly vigilant, patrolling, pacing. We never get any rest. They're crazy. If he were a human, I'd say he had ADHD, although we have to be really careful with cross-diagnosis in those sorts of cases. But I think all of those things are off. He just can't rest. We can't get a moment's peace. Those are all the sorts of terminologies that clients will give you and that they're experiencing. But it's super interesting that, you know, your dog was showing typical working breed dog signs, right? So I think there is something in that. And I know you sort of, that resonated with you when I said a lot of the kind of the study work has been done on working breeds. So it'll be this like, you know, constant drive to do something. And I think we have to be really careful, though, that we're really mindful of all the other differential diagnoses that there could be for that. And that could be physical health differentials, so true neurological signs, even things like hyperthyroidism, even in dogs, chronic pain, cognitive dysfunction in older dogs, anything that might lead to a neurological presentation, so anything like a hepatic encephalopathy. So I think that, but also we have to be mindful of other behavioral differentials that we could have. So generalized anxiety disorder, also these dogs can also really struggle to settle. They can also be super hypervigilant. They can also pace and all that sort of thing. So there are a number of other differentials. It could be completely normal behavior. We know that around 20% of dogs as individuals have a tendency towards more motor activity. Could be that they're not getting enough exercise. It could be that their behavioral needs aren't being met. They're understimulated. It could be that for some reason behavior or movement has been reinforced inadvertently by the owner. So we have to be really careful about looking in all the different directions to try and understand, is this normal behavior that is a nuisance to the owners, and they're, you know, that's how they're perceiving life with their dog, or is this a truly kind of pathological behavior?
So how do you kind of sort through that then? Because I feel like some breeds, you know, like maybe Labradors, they're always, a lot of them can be always on. I know sometimes these dogs with hyperactivity can have some pica-like behavior. And how do you sort through, okay, this is like normal lab versus this is something I need to treat?
Yeah. So that's a great question. And I'm actually going to refer to a really great resource by Dr. Karen Overall, an amazing veterinary behaviorist who has also looked at this quite a lot. And she kind of groups these behaviors into 5 different groups. So she talks about overactivity, generalized anxiety disorder, true hyperactivity, hyperreactivity, and then attention-seeking behavior. So she kind of classes them into these 5, and then she has a number of things that she looks at that helps her to determine into which of these 5 categories these dogs fall. And I can share, I'm going to share in the show notes that resource and how to kind of look at that. But so if you have a dog that is overactive, but that is able to settle when it's appropriate to do so, then that might be more that normal dog that is kind of being overactive. So your lab that's being just a normal lab, if we increase physical exercise and then when he rests, he actually rests and is able to settle, then that might fall more into the realms of normal, maybe just understimulated. Whereas if you've got a true hyperactive dog, they usually find it really difficult to settle at any point in time. And then they even have signs of this sympathetic arousal even when they're trying to rest. So they'll have increased heart rate, increased respiratory rate, you know, and they really find it difficult to switch off that motor activity in any given moment within the 24-hour period throughout the day. So that's a way that you can start to sort of weed it out. If you're seeing other signs of distress or other signs of anxiety, then we might be looking, have we got an anxiety disorder? And the overactivity is one manifestation of this anxiety disorder. So there are, within the behavioral signs, ways of starting to put them into categories of what might be normal or what might be truly hyperkinetic. And then if you have a really strong suspicion that a dog is pathologically hyperkinetic, you can do a medication test. So you can use a stimulant medication, which we don't often use, to see if there's a response. So stimulants would be things like amphetamines or something like Ritalin, methylphenidate, which is used for ADHD in people. And it's really important to stress that they are not therapeutic drugs. We don't use these medications to treat dogs, even if they have hyperkinesis, because they're so short-acting and really difficult to administer. But from a point of view of diagnosis, if they respond really well to a stimulant, i.e. the dog actually calms, settles, heart rate reduces, respiratory rate reduces, and there are certain protocols for how to administer these meds, then that's quite a positive indicator of I've got a truly hyperactive, hyperkinetic dog. And what that means truly means that the neurotransmitter systems that are affected would be dopamine, serotonin, possibly noradrenaline. So it goes back to what's actually happening in the brain. Is there a true pathology in the neurotransmitter pathways? Or is this a normal dog that's understimulated, falls in that 20% of more propensity towards higher activity, or needs aren't being met sort of thing?
Okay. And so let's say they're positive for that test. What kind of medications are you typically looking at long term for them?
Yeah, that's where it starts to get tricky.
Yeah.
So again, if we're thinking that we want to be targeting all 3 of those neurotransmitter systems, then a monoamine oxidase inhibitor such as selegiline, so your guys' Anapril, would be potentially something, and that's also in the literature. The other thing that's in the literature is a higher dose of fluoxetine. So there's a paper from 2021 by Sylvia Masson and Stefan Bloyer-Elsner there in the European College that did a retrospective study on this HSHA syndrome, and they used 2 to 4 mg per kg of fluoxetine, which seemed to help with the signs, but 2/3 of those dogs, so 61%, I think, of those dogs showed adverse effects to that higher dose of fluoxetine. Some of those were manageable. I think in a very few cases they weren't, and the dose had to be reduced. So those are the two things that are in the literature. But then, of course, you would perhaps look at other sort of symptomatic, like would you perhaps target noradrenaline with clonidine, for example? Would you trial some of the other? Clonidine seems to be a really good one in hyperarousal, which might be part of hyperactivity. But because of that motor system thing, the dopamine system is probably involved in that true hyperactivity. And I think they're not easy to treat. And then, of course, ruling out all your physical health contributors potential, making sure that behavioral needs are met, that you're managing the environment, you're managing triggers. I have had a couple of colleagues use stimulants, but all with pretty not great results, because they last for a couple of hours and then the dog goes back to showing the behavior again, and you would need to dose so frequently. But a couple of my Canadian colleagues have said that, the clients have said that's like the first and only time when the dog's received a stimulant that they've actually been able to rest and settle and sleep. So, yeah, I think we haven't maybe found a good enough stimulant drug for veterinary psychopharmacology yet, but yeah.
Do these dogs ever improve as they age, or is it something that gets worse a lot of times?
Look, it might get worse if you start to then get signs of cognitive dysfunction and pain and other physical challenges. I don't think they improve as they get older, to be honest. I think if it's truly a problem of the neurotransmitter pathway, then, and I actually think some of these dogs are euthanized because they just don't have a quality of life, and nor do the clients.
Yeah. And what age would you say is kind of the youngest that you can peg this as a diagnosis? Because sometimes, there's puppy behavior and then there's this.
Yeah, it's a good question. And again, I'd go back to looking at are they able to settle at any point throughout the day? So even if it's a puppy or an adolescent dog and they're super active and that's just like their life stage and they're super bouncy, they should still be able to sleep and rest a considerable amount of time, right? Like 12 hours at least out of 24 or even more. So can they rest and then also crash out after they've had their crazy episodes? Or is this persistent and they're unable to settle? Or do they have developing anxiety? And that's the timer. You see what I mean?
Yes.
I know you could talk about it for hours. I mean, I could talk about it for hours.
Yeah.
So, yeah. Anyway,
that's been great. Thank you.
I'd love to ask you though, before you go, how have you been able to manage your dog? What has worked for your dog?
So he is on fluoxetine daily and he's on clonidine twice a day. Okay. And that's been a game changer for us. Yeah. And if we're in hyperarousal situations, like if we're at family's house where there's a lot going on, he gets higher dose of clonidine.
Right. Perfect. See, exactly that. And that's what I meant with these hyperarousal, but that might not be true, right? If he's responding well to that, I wonder whether your dog has that real hyperkinesis and hyperactivity, or if he just gets overstimulated, over-aroused, and just gets a bit
Yeah.
Yeah. Is he able to settle and sleep? And
not even as a puppy. And that's what the other behaviorist had asked me. She said, did he show up on your doorstep like this? And I was like, yeah, he doesn't sleep. He doesn't settle. I mean, you can put him in his crate and he'll sleep some, but he never, otherwise he's go, go, go. No, he doesn't lay in his dog bed. He doesn't do anything. He's always into, just doing his stuff. So
even on the fluoxetine?
No, not on the fluoxetine. This was pre-treatment for him. Right. Now that he's treated, he does settle, and he's not pica anymore, and he's a lot better. He's a lot better citizen.
Nice. It sounds like you received exactly the right advice for him. So that's brilliant.
Yeah.
Yay. What an interesting topic. Thanks so much for coming with this one, because I love talking about this. It's so complex. And the cases are hard to manage, as I'm sure you know from personal experience, although you've obviously been able to manage it really well. But I think it's hard for caregivers, for owners to live with these dogs that just can't switch off. I think that's
yeah. It was definitely affecting the peace in our house between the two dogs, especially.
Yeah. Because I think the other dogs are like, what is wrong with you? Like, just chill, I think they're a little bit kind of put out by the abnormality of the affected dog's behavior, and they find that difficult to deal with and to read sometimes, and to manage themselves.
Yeah, for sure.
Good. Alrighty. Well, I hope you've had a useful conversation.
Yes, this has been excellent.
Brilliant. I love it. So thank you so much. And then for everyone listening, if you would like to feature in a 15-minute speed coaching episode, I'm going to put the link in the show notes to where you can apply. I'm also going to put the link for my psychoactive psychopharmacology course on there. If you want to know more about fluoxetine, clonidine, some of the medications that I've just talked about, selegiline, that's a great course. And if you have a case that you would like help or support with, I offer 30-minute or 60-minute vet-to-vet consultations for any cases you might be struggling with. Quite a lot of options to get in touch and to work with me. But I hope you've enjoyed today's episode as much as I have. And I want to thank you, Dr. Laura, for joining me and for bringing this great topic. Thank you so much.
Thank you.
All right. Thank you so much for listening, everyone. And I will see you next week for episode 124. Bye for now.